Dusty, we might want to check to make sure we're live streaming before we start the meeting.
Okay. Sir?
This isn't considered a county commission meeting, it's just a work session. Okay. And we don't allow public comment during
But it
the,
is open
Do you
to
have
the
a paper copy of
public
this?
Right.
okay,
and is being broadcast,
Okay.
public viewing.
You could pull that.
all right.
Well, it doesn't make a really nice.
So it's a public meeting without comment.
Okay. Oh, I had a,
I don't know if we're live streaming or not. We are? Okay. It's Monday, and I'm gonna check.
are we ready?
It doesn't say it's live. I don't know if it's live streaming or not, for sure.
Well, there's like a 2-minute delay, or no, maybe not 2 minutes, but there's a short delay, so it might not even be on there yet, if it is live streaming.
This is the test in public.
Not live streaming yet.
It's on.
Okay.
Okay.
All right. All right, welcome to the work session concerning wearing masks in Shawnee County. It's July 6, 2020. This is a work session where it's open to the public, but public comment is not allowed at the work session. We're going to start off by having Dusty Nichols from Emergency Management start us off here. So,
Good morning, sirs. Dusty Nichols, COVID Response Team Incident Commander. After last week's order from Laura Kelly, Governor Laura Kelly, you guys opted to use that as recommendations and charged us with coming up with at least a starting point using Wyandottes order and some other orders to develop some language you can discuss and develop a Shawnee County order regarding masks. Just to kind of start off a situation summary, these numbers are changing. I was just looking at Ashley's computer, so this may be adjusted, but as of yesterday, that was what we're looking at. The community spread is 50%. So with this, I'll go ahead and turn it over to Dr. Pizzino. You had a few comments before we start.
Good morning, Commissioners. Gianfranco Pezzino, Shawnee County Health Officer. I don't have much to say. I just want to spend just 1 minute to remind you of the backdrop to use during the discussion today. And that's a backdrop of an increasing number of cases in Shawnee County in the last few weeks, between 50 and 100% increase. We had, we are still counting, but we had over 150 cases last week. And the week before, which was a record, we had 101. There is an increased number of, we have several deaths in the last few days, increased number of hospitalizations. As of yesterday, we had 12. Laboratory are lagging behind in their testing procedures, so we are seeing an increase in the lag time between the time a laboratory specimen is collected and the results are received. We have a health department that is overwhelmed to the point that now it takes maybe 3 to 5 days to reach each of the cases. Our standard has always been 24 hours. This is a very different scenario from 2 weeks ago, 4 weeks ago, perhaps even from last week. And it's one that really requires action. It's one that can deteriorate very quickly. I think it's a little too soon to tell. I have the fear that we are starting to get into exponential growth for our cases. And what that means is the number of cases will double every X number of days. And that X, of course, is a critical factor, but it can be anything between 5 and 15 days. But when we see that kind of curve going up exponentially, that's something that's really hard to stop. Then eventually it will stop, but at a very dear price for everybody. I think it's time for action. Unfortunately, we don't have a lot of time left to think about it. I'm sure that if we had a couple more weeks, we could make each and every one of these orders much better. But the timeline is dictated by the virus, it's not dictated by us. So I urge you to keep that backdrop in mind when we have this discussion. Some ideas that you see in front of you today may not have been things that I would have proposed 2 weeks ago. There may be things that I proposed today. There may be things that you would not have supported 2 weeks ago, but maybe you would be willing to support today, given that change in the environment and the backdrop for this entire discussion. Thank you.
So what we set up here, talking with Ashley, this might be the best way to go about the rest of the work session for you. Just more background on the command side, the incident command side. This is we want to bring this to your attention. If we cannot slow the rate of spread, we are kind of going back to the beginning of this whole thing, where we're worried about resources and such. So there's no timeline for this, but obviously at the rate of spread, and you see it across the nation, many places. If we can't slow this thing down, this is what we're worried about. Again, this is worst case scenario, but it's still something that we're concerned about the whole time we're doing this.
When you say, in that paragraph above, it says overwhelm the health care resources.
Sir?
What are we talking about, healthcare resources?
We already maxed, sorry, I didn't mean to over-talk you there. We already maxed out, or pretty close to maxed out. Linda's, I don't know where you
Is
want
this
to
on
talk about
tracing?
that specifically.
Contact tracing? Is that what we're
I'll
talking?
let Linda discuss that directly.
Okay.
Good morning, Commissioners. Linda Oaks from the Health Department. Yes, we are getting maxed out with contact tracing. We did hire that company a couple weeks ago. You might remember they are still hiring people and onboarding people. They have some training they have to go through because of the nature of what they're doing in the new legislation. So it takes time to get those people on board. So right now they're taking, 10 to 15 cases a day. We still have some volunteers. We're onboarding some new ones this week. So knock on wood, I'm hoping that we at least get caught up this week, but I don't know that that's going to happen. So right now we're getting the cases investigated probably 3 to 4 days after we receive them, and we're telling people, stay home, start your list of your contacts, and we'll be in touch.
We're not overwhelming hospitals, though.
I'll let Dr. Zeno talk about hospitals or Dusty.
At this point, Commissioner, we are not overwhelming hospitals. I did talk to hospital executives, and they are concerned about the trends that they're observing, which is one of swinging for hospitalizations, and also they are concerned about the proportion of tests that they conduct that comes back as positive. So they see all the signs, all the writing on the wall for an increased number of hospitalizations. Keep in mind that typically when we have a surge of cases in the community, it takes 2 to 4 weeks for the surge to translate into an increase in hospitalizations, and we are not there yet in Shawnee County.
Okay.
So with that, there's just the background, and you guys are caught up on this, how it spreads, the best way exposed, so forth. I mean, we've talked about this so many times, it's just in here. If you had any questions, we could refer back, then how to slow the spread. Of course, that's the recommendations from CDC. And then this is the meat of what we're talking about. This is what you charged us with last week. Took the Wyandottes order, a couple other orders we looked at some best practices, made some phone calls to see what Wyandotte could have done better on their order. I contacted those areas, those organizations that they said they could have done better with, and reworded some things to kind of fit, not kind of fit, to better fit the situation here. So, turn it over to you, and I'll make the changes as we go.
Good.
Just an observation, I'm sure this could get worked out, but the way that last part of the bold statement reads there is required to wear a mask or other face covering the nose, and it just, I think we may need to add another word, because it sounds like you might need to put a different face on.
Or other face covering device.
Yeah. There we go. Thank you.
You bet.
Okay. On that third bullet, the way I read that is, if you're in a restaurant and you're eating, but then you're just sitting there, you have to put a mask on if you're done eating or you're not drinking. It says at all times.
Yes.
So you can't just eat and just sit there and talk without having a mask on.
I'm not sure the protocol here. That, I thought it was a discussion. If you had
Yeah.
questions specifically.
Well, I mean, in order to have consistency, Commissioner Rippon, the advice from the doctor, the advice from the medical professionals, including the hospitals, the doctors that we've heard from over the weekend, it's a two-prong rule. Are you more than 6 feet apart? If you are not more than 6 feet apart, put on a mask.
Okay.
I mean, it's not complicated. I don't know why we're overthinking this.
That's another question. The 6 feet apart, that's what the CDC recommends. I noticed the World Health Organization, they're using 1 meter, 3 feet, basically. Is there a reason?
I'm not sure I can answer the question, Commissioner. I am aware that there are some different standards in Europe, although what I've seen is that in many instances they still recommend 2 meters, which is about 6 feet, and when that's not feasible, 1 meter would be enough. I know in this country 6 feet has been the standard since the beginning. I cannot tell you exactly why. I would be a little concerned if the rest of the United States adopt 6 feet and Shawnee County says no, 3 feet is enough. I think consistency is really important. Regarding your question about the restaurant, look, I'm all for common sense here.
Yeah.
And so I think the point of that bullet is to make sure that when people walk into a restaurant, they have a mask or a face covering. While they're seated and while they place their order, their face is covered. So they protect the workers that come and serve them. When they eat, of course, they have to remove the mask or whatever they're using. When they're done eating, if they're just having a conversation with their party at the same table, if I'm talking to my wife and we are alone and there is no server around, I'm probably not going to put my mask back. But if the server comes back and asks, do you like something else? Can I bring you a check? That would be appropriate to wear your mask because, again, you are protecting that worker who isn't going to be in contact with many other dozen tables during the same day. So as Commissioner Cook will say, I wouldn't overthink it to the extreme. I mean, I don't think anybody's going to go after people for keeping their mask off while they're sipping on their wine at the end of a meal. That's not the point.
Commissioner?
So, as I read through all these different orders, one of the things that I'm concerned about a little bit, and not so much with each order, but I want to make sure that whatever we do, it's easily understood, that we don't have to have, this for that and that for this, so that people can understand what we're actually doing. And so the simplicity of this order is important to me because I feel like that's the best way to get compliance. We can wordsmith and come up with the perfect order, but if people don't understand it and people don't respect it and won't follow it, then it's just an exercise in futility. So I think that whatever we do, we need to make it easy to understand, I think is what I'm trying to say.
And that
Right.
was my takeaway from reading the document over the weekend and looking at it, is you come down to really that two-prong. Are you more than 6 feet apart? If you're less than 6 feet apart, wear a mask. There is an exception if your contact is incidental in an office space for less than, 10 minutes, I believe is what the word is. But it just a momentary contact.
Which leads me to say that when I read the Douglas County order that they put out prior to the governor's order coming out, I do like the way that they word that. And I'd actually ask you, what do you think about where it says employees or visitors to any place or of indoor public accommodation must wear face coverings in an area while performing an activity which will necessarily involve close contact or proximity to coworkers or the public where 6 feet of separation is not feasible. I mean, it seems reasonable to take, it kind of takes into account all of these nuances that we're talking about, where people are together for close period, in close proximity for long periods of time and things like that. Is that something that was last week's news and now we're on to something completely different now? Or, what do you think? Is that an acceptable language, or?
I think a version of that we could put at the very top of this, just as like Dr. Bazzina said, it's kind of a common sense, hopefully, a common sense, experience sense, more like it, phraseology to put at the very top of this, just to be more inclusive, so I can, something like that.
I'm just trying to get an opinion. I'm not saying that that's 100% what we should do. I'm just asking.
I
We can
think
do
too, it's a little
something.
bit cumbersome, and I look at the governor's plan, and it's much, she's got like 4 bullets here, and it's easier to understand, I think.
Do you have a specific bullet or a set of bullets on a page? that
You mean
like?
what the governor had? Sure.
Yes, sir.
Yeah, we have a copy of it right here.
Here, Dusty, it's 1D, I think is what you're looking at.
1B.
1D, as in dog. And that says while outdoors in public spaces.
Oh, I was thinking about the whole, I was thinking of
So I
something
can,
different.
I can go grab that and.
I think that's what Commissioner Mays.
While
was
outdoors
saying.
in public space, that one?
Yeah, but I think that if, Commissioner Mays, I don't know if you want to look at governor's
I've got
executive
it.
order 1D.
The only thing that bugs me about the governor's is, there's 2 issues you're looking at. You're looking at social distancing and time. And time isn't defined. It's,
I think on the time is the inconsequential passing, like in a grocery store, that kind of thing, versus standing talking to someone. That's
yeah, but
that
is that-
10-minute mark.
Is that a
if I'm
minute?
not
Is that 10
mistaken.
minutes? Is that? I think we've defined social distancing at 6 feet, but what is time?
I just think, again, I go back to the simplicity that
Well, that's,
if we get to, really what we want is when people walk into a building, put on a mask.
Yep.
When you get to a place where you're not around other people, feel free to take it off, that kind of thing. Am I wrong in that? I think that's reasonable. Because obviously, if you're, like right now, I'm pretty far away from you, I'm far away from, there's nobody over here. I don't feel like Commissioner Rippon's putting me in jeopardy or vice versa. I don't know, how can we accomplish that? And I know the governor's plan, I'd look at it, and it is complex. It's 5 pages long.
yeah, but a lot of it is,
Yeah, the first page is a preamble, but
the preamble and some other things. Some of it doesn't pertain to us at all.
If you'd like me to take
There's-
select bullets, like, we can insert those.
There
this
are
is-
problems with the
well-
governor's plan as well. I've
Sure.
reviewed through a lot of
yes,
it.
please.
I'm all for simplicity too, believe me. One challenge we are having is that if we leave it so simple that it only describes the general goal, I agree with your goals, that's what we want. there will be a lot of questions about specific situations. Some of you have seen that already
Yeah.
this weekend, where, and so, and those that you haven't seen will come then to Dusty after this order is approved. Well, wait a minute, you didn't think about us, you didn't do this, you didn't do that. So
Yeah.
what we tried to do was addressing as many of those specific situations as possible in the order, so there would be less ambiguity. I personally am totally welcoming your comments to make it even simpler, but the simpler we make it, the harder it will be then to manage it later on. So, and you know very well that some of these bullets are here because some of you asked to address those specific situations. And yes, the governor's plan is simpler in the first part, but then you flip to the following page, it actually has even more complex specifications than what we have in our plan.
Dusty, could you scroll up towards the top of this page just a little bit? I wonder what stuff there, let's see. Down to, at that bottom paragraph.
This one here?
Yeah, it says, a resolution to stop the spread of COVID. We can't stop.
That's a good point. I should have reworded that to control.
Let's take stop out of there.
We'd like to stop.
Slow it, maybe, but we can't
Control, I like the word control.
control, but stop is impossible.
That's correct, sir.
Okay.
I think, though, from an enforceability standpoint, don't we need some standards that the counselor's office or whoever would be able to also use as to whether or not the rules are being followed or not? I'm looking to maybe Jim and Ashley for their input. Again, I'm all for the simplicity, something that's easy to understand, but we also have to look at if we are going to ever have any enforcement, we need to have some standards.
Good morning, Jim Crowell, Shawnee County Counselor. Well, that is the rub, isn't it? You can, it's a balancing act between being specific enough to outline specifically what's required and what's prohibited, and being general enough that people understand. As a criminal defense attorney, you know that if you're going to enforce criminal penalties, those specific requirements have to be spelled out in order to survive a court challenge.
But the legislature, the legislation they passed during the special session prohibits us from having any criminality to this. This is only, there would be a possibility for civil penalties, but not criminal.
I understand.
Okay. Oh, you're just
But-
speaking in his,
I'm-
referencing
But
him and
just-
his.
just- But still,
Okay.
even if we were looking at civil penalties, we'd still have, how do you go about enforcing this? And so, I mean, we'll obviously get to that, I think, a little bit later, but getting back to your where you were looking at in Douglas County, can we contrast Douglas counties to also the governor's 2E, and maybe some variation, a combination of that? Taking out the part about the employees, because it does talk about, except for infrequent or incidental moments of closer proximity.
Okay.
Employers are,
And so I'm looking at that last line, the except for infrequent and incidental moments of closer proximity. And I think that may be what you are
Honestly,
referencing and looking to.
When I look at the governor's order, item number 2 in its entirety is actually pretty decent, in my opinion.
Other than, yeah, there's some issues. I think walking through a parking garage, having to wear a mask is a little over the top.
Where's that at?
Employees to see in a parking facility.
Parking facilities, yeah, we could probably take out parking facility. Elevators, stairways, hallways, those make sense.
Your
Common
hallways,
areas.
and yeah, that's no different than walking through a grocery store, though, I mean.
But don't we
Uh-huh.
always come back to, are you more than 6 feet apart? If you are more than 6 feet apart, put on a mask. Unless it's
Or
for
less
very
than 6
brief,
feet.
infrequent, incidental contact.
Well, I can tell you, I park in a parking garage at work, and I'm never anywhere near 6 feet close to anybody, so, maybe it's good practice to put it on your way to the elevator, but.
Right.
But I also can't imagine a scenario in which somebody gets in trouble for not wearing a mask in a parking garage.
Oh.
So,
But I think part of this too is, we've had incidences where the public will take on a quasi-vigilante role, and I don't want us to have that occur in our county as well. And so
Okay.
we have to have something that is easily understood, easy to recognize. And again, I like the section 2 from the governors as well. We have a lot of that in ours, it's in a little bit different form, but it has the same formats, the same spirit of it.
Okay.
So,
I-
but going back to, I mean, Commissioner Mays, you had raised this, having a preamble, I guess almost as to our resolution. And so if we have a summary preamble, which would encompass the spirit, and then we get into the details, could we live with a three-pronged part, which is, are you more than 6 feet apart? If you aren't, wear a mask, except for infrequent incidental contact. And then we could get into the clarifiers of all the rest.
Yeah, that makes more sense, because you look at A, on the governor's 2A, that, you could have a guy who's in say he's a sewing machine repair guy. He has 5 people come in the afternoon. When no one's in there, according to this, he should have a mask on.
I look at this and I think,
That's just nuts.
Sorry.
I'm sorry.
I think of like our county treasurer's office. You know, there could be a situation where we have 20 employees up there milling about and no taxpayers there to pay taxes.
But then they should be
Yeah.
wearing a mask.
Right. I mean, that's how I read it, but
What if you're just in your cubicle?
And there's an
that's,
exception down.
yeah, there's an
later.
exception for that later on in the order. Oh, yeah, any room or enclosed area, I think that would encompass cubicle.
Well, that's,
Just to kind of keep us on task, and again, knowing that we're at 8:30, and I don't want to get to 8:50 and not having got through this.
Right.
And so if we could, and again, I would advocate for adding a preamble with a simple 3-part, maintain 6-foot distancing. If you are unable to maintain 6-foot distance, put on a mask unless for incidental, infrequent moments of closer proximity.
Right, which I think you guys had kind of had that covered in the how it spreads and stuff. I
I
assume
can-
that would be
I
worked
could,
into a preamble.
I could work in a spirit of the order kind of.
Because
That's,
Thing.
that's what almost all these have, the whereas, it's sort of something like that where it works that in.
but the rest of the outlined recommendations, I'm good with.
Well, I think we need to, what I would like to see is maybe take this on in different pieces. Because the way this is worded, well, maybe it's not this particular order. I'm trying to, there's like 4 of them I'm looking at, I get them confused. But I do think that indoor and outdoor probably need to be separated. Also on the second portion here, you had the outdoor spaces and public transportation, taxis and ride sharing. I think those need to be separated. I think the public transportation needs to be separated from outdoor spaces.
Can I understand, sir. Are we okay with this first
I
bullet?
think you can take out the insert 1D, governors, take out that part. That's basically, there you go.
which one?
No. Oh, Dusty had added when we were talking about Douglas County and the discussions, but I think he has that now where he's added
Yeah.
including a preamble, the spirit of the order.
Okay, would that eliminate
No,
2A?
no.
No, I'm going to try to
What?
capture all the stuff you guys are talking about, just as far as experience sense, common sense, whatever you want to call it, working in some kind of paragraph so it's easily understood and then detailed out. Because if we don't detail it out, I will spend all day on the phone, and the hotline will too,
Well,
taking complaints for parking garage stuff.
Would you feel comfortable if we just took item number 2 from the governor's order and then took out the parking facilities. Because I think it is, I think that particular order is pretty well written,
Make sure
or that portion of it at least,
Section 2 of the governor's order?
yeah.
Which
Without-
part of
without
section
C?
two?
The entirety.
The entirety of it.
The entirety of it?
To A through E.
Yeah.
And then just take out the parking facilities in number C. Letter C. I said number
I
C.
don't- It's,
Parking facility, take that out.
yeah, I got it right here.
What about,
Sure.
but A, I'm confused. Which one are you still leaving 2A?
Yes.
Yes.
2A doesn't make sense to me, because you have a guy working by himself in a business, he has to have a mask on.
Well, again,
I-
That doesn't make any
I
sense.
think I can cover that in the spirit. I understand where you're going, sir.
Yeah.
I can do something.
I mean,
I think that goes back
Really?
to if you're sitting by yourself in your
the
office.
the other thing is, if you're working in a space where food is prepared for packaging, does this include cooks? And I mean, if you're in a hot kitchen, you need a mask on the whole time? You're not
You want
out
that
with the
one?
public? Would
You might have
cooks,
to repeat that, sir.
it says employees are working in any space where food is prepared or packaging for sale or distribution. Okay, if you're a cook in a kitchen, you have to wear a mask, according to this? Is that,
Well,
that's
I
preparing?
cannot tell you whether according to this you have to wear a mask, because that's not the text that we develop. I can tell you what we thought when we developed our text. A cook who's working in the kitchen and does not have any coworkers around within 6 feet would fall into one of the exemptions that we created there. So if you're not in contact with the public or with a coworker, then you wouldn't need to wear a mask. We had a similar question, yes, in a conversation with our bar owners. How about the bartender when there are no customers and, she or he needs a break and there is nobody around? Can they take their mask off for a couple of minutes? Absolutely. There is nobody around, there is nobody around to infect.
I know.
but along that same line, in a restaurant, in a kitchen, if you're preparing food, wait staff is usually coming and
Right.
going unless the business is, in a very slow period of time. But generally speaking, if there's a lot of business in the restaurant, there's going to be wait staff coming and going very frequently. And so in those cases, even though it's hot, you should probably have on a mask.
I agree, that's why I was saying, if there is nobody else around.
Okay.
The other thing also is that we want to make sure that if an outbreak happens in the kitchen of a restaurant, that restaurant has to shut down. They typically don't have backup cook staff. So I would say that, that's probably a good reason to have that. But going back to item A, Commissioner Rippon, you have mentioned that, and so I would suggest that we change that language. We cross off regardless of whether anyone from the public is present at the time, and put if members of the public are present at the time.
Okay. All right.
What are you looking at, real quick?
On the governor's order.
Okay.
2A.
What he referenced, the guy in the sewing machine shop, that this basically says that if there are customers in the building, if there are customers in the place, then they have to put the mask on.
Yeah, the way it's written, it's regardless if there's anyone in there or not.
And so we would.
But I think
Remove that. yeah.
I think it would make sense to put if members of the public are present at the time.
Okay.
And again, that's applying some common sense to,
We add also the coworkers, though, let's not forget.
Can we add coworkers? We can't forget them.
right, so if,
Members of the public and coworkers.
or coworkers.
Yeah.
Or coworkers.
Which section was that? I'm sorry, it was,
2A.
2A.
and you're on
Of the governor's
the governor's order, okay.
So basically, we're adopting all of 2 right now. And this is still subject to change, but modifying to A and to C.
And we took out parking facilities.
And that would replace the recommended indoor restrictions that we put in our draft.
But can we add it to the indoor space recommendations that we have? Because I think there's some really good spots in here. I think that there's some good clarifiers in the language that was prepared by Dr. Bazzino and Dusty and Linda. Can we add it to it? Or is that going to be too cumbersome?
I think it might be.
Well,
I think we probably, like I said, I'd like to keep it simple, so, I mean, obviously, we're not gonna come up with a final perfect option today in this meeting. I'd love to see it today, but not in this meeting.
Yeah.
I don't know, is that too much, though? Because I think there may be some redundancies if we add more and more.
But is redundancy a bad thing? I mean, they don't conflict. As long as the redundancies don't conflict, they may be saying the same thing in just a different way.
I do find in talking to people, when they look through these orders, they look for the bold bullet that applies to them, and they don't look at anything else. So
So-
if we do have a redundancy in there, it's not
Well, I
necessarily
just
bad.
wonder if, so the governor's order, I think, encompasses in this section 2, most of what we have put here, but it's just different wording.
So, I mean, if you were to look at the second bullet point, masks or face coverings are not required inside a solitary space such as an enclosed workspace. That would be a cubicle assigned to one worker.
Right, and in the governor's order, it says employees are in any room or enclosed area where other people, except individuals who reside together, present, unable to maintain a 6-foot distance. I mean, it's the same thing, it's
It's
just
the
worded
same
differently.
thing, but I think, again, having it there in two different places increases our chance of people getting it. If they're not in conflict. Now, if we had two parts that were in conflict with each other, I would agree. But repeating it while redundant is probably not the worst thing that we could have. The worst thing would be two parts that are in conflicting with each other.
I definitely agree with that.
sometimes that gets cumbersome, though, when you're trying to read through and find things, and then
I'd like to
I
keep
like.
it simple.
Me too.
So,
But I
mean,
don't think that you need, the danger in simplicity is oversimplifying it and leaving big gaping holes, or people will create loopholes. And again, we come back to just public safety. At the end of the day, no one wants to wear a mask. No one wakes up in the morning and says, I really look forward to putting on my mask. We do it for public safety.
Let me try to capture most of what you're talking about here into the spirit of the order, and then I can do shorter bullets versus expanding and still keep some redundancy or do a reference back. I can do that too.
I would appreciate that.
All right, well,
Okay.
should we move on
Move
to
on, let's move on.
the next
Next section or next bullet?
bullet? Oh, I'm sorry, there was there were a couple, I'm gonna go back. When you say other face covering, does that mean face shields? Because
There's-
I had a conversation with Dr. Pacino the other day about, I think it's important that we put the option of face shields, because one of the things that we keep hearing over and over is the masks are bad for you, and I don't want to get into the debate of whether or not that's real or not, but it would be good at least to have an alternative. So if somebody just absolutely refuses to put a mask on because they, for whatever reason, they can't do it, or they just don't want to, or whatever, that we at least have another option.
That's page 3,
Yes.
second bullet point from the
And
bottom.
we do have it, but it's limited to people with medical conditions and not to anyone who may have just a simple preference for a face shield. And the reason is that face shields, while somewhat effective, they are not as effective as a mask, because as you can imagine, they are open on the sides and they're open at the bottom.
Dr. Pitts, like down in our upstairs where people get their tags here at the courthouse, we have these plexiglass shields. Is that sufficient when you're dealing with the public, or do you still need a mask?
I think you still need a mask. Again, they're just different layers of protection, none of which in isolation is going to be perfect. When you put all of them together, I guess they add something. That's why healthcare workers who have the highest risk of exposure wear both the mask and the face shield. Now, I'm not suggesting that for the general public, but the face shield is not as effective, so I would not recommend to include it as an option, face shield, mask, or other face covering. But in situations where there is a medical condition and the person doesn't feel comfortable wearing a mask, a face shield could be an acceptable alternative.
And that would be things such as asthma,
Right.
again, problems with breathing,
Right.
respiratory
Yeah,
issues.
frankly, sometimes it's just a subjective experience that, the doctor told me that I can't breathe well, and that's because I have a mask. One could debate whether that's really the only option or not, but in those cases, I think having a face shield could be acceptable, but
If it raises anxiety, it causes panic.
Commissioner?
Right.
I go back to a couple of things, and I realize that a face shield's not as good as a mask, but I go back to what you said last week. Some is better than nothing, more is better. I mean, I feel like if we're just saying masks primarily, that there is a segment of the population that just flat out won't wear them. And if people aren't complying, then we run into more and more problems. And I feel like a face shield is a decent alternative to at least get some level of protection on those folks. At least give them an option. But, I mean, it's up.
I would like us to have this as adopted now, and then go for implementation, and then we would be able to revisit this as we have more information. Obviously, this is a very evolving field, where we went from no masks to now we're looking at masks, to where we focused on antibacterials, and now the antibacterials are not the main line. They're still a defense, but they're not the main line defense. And so I would like us to leave what we have in place and then revisit that as we have more information, as we collect more data. But again, having the exception, if you have a medical condition, if it's a medically, where it would obstruct breathing. I would anticipate that we are going to have a level of people that will create medical conditions for themselves in the same way that those states that have being able to consume marijuana, they create exceptions. But again, we come back to people, this is something that's easy. It's not difficult. For the most part, you're not going to be wearing this for 12 hours a day.
Can we, I think that's all I had to say on that topic. Are we good, you think?
Yeah.
Because we're running out of time, so.
I wanted to see if we could go to enforcement, and talking about the enforcement. The statute, we don't have that included here.
I did want to visit something
Okay.
yet. In the governor's plan, she mentioned sports. And the version I have of yours, it really doesn't cover sports at all, that I can tell. Maybe can be
You're in the-
extrapolated from something
Is
else.
that in the exemptions?
It was, no, it was section 3G.
Yeah, that's the exemptions.
To me, someone's going to say, well, does this allow for football? Or does this allow for volleyball? Or does this allow, because that's what people want to know when they look at this. Because you can interpret this in a number of different ways. But that's what people want to know, is what sports can you play? And, know what I'm saying?
I do.
I think it just leaves it. This
I think we-
This is one of those things where it's a big hole and there's loopholes there to.
We do have some wording specific.
We don't address that in this particular order or draft that you have in front of you, but in our broader order that we have refined over time since phase 1 and 2 and 3, sports are addressed there, and we make a distinction between contact, non-contact sports, and the size of the teams and so on. So, again, if you adopt anything along the line of the mask requirement that we are discussing here, that needs to be put in the context of all the other orders that we have in place. And I know we are running out of time, just really quickly. I know it's going to be hard. I am really urging you to adopt something today, commissioners. If we don't,
Yes.
You have two problems. First of all, of course, you keep a health hazard in the community that needs to be addressed. And second, based on my experience, I think you're going to be inundated not with 400, but with 800 emails at this time saying, I thought you were going to do it on Monday, now you didn't do it even on Monday.
No,
Just this is my opinion, it's not the health officer talking to you. just
You
my
don't
opinion.
feel that the orders that we had in place before the governor's order are adequate?
They don't address masks, except for restaurant and bars workers and a few other workers, but not for the general public.
It was my hope that we could have this work session and then have something we could adopt at our meeting today. Again,
Well,
That's kind of where I've been talking to people about it and saying we'll have some kind of a resolution on Monday.
Commissioner Rippon, as to your question about sports,
yes.
under the governor's order, Section 3, looking at item G.
Just a second, let me find three.
Yeah, that's what you
Yes,
just-
yes.
that's what he just
So I was just
and-
talking about.
And H, that would be like gyms.
We do have some language that I can put in here for pulling out from the other order, talking about sports that we've had in there before.
So,
It just wasn't included in the work session draft here.
yeah. So again, go back in like 3G and 3H, adding those two that would address sports
Okay.
and athletic gyms.
And then we'll need to work on this infrequent or incidental moments of closer proximity. I guess we'll have to figure out what that means exactly. Maybe we'll take it on the surface as to mean that, football, you're only running into the other team for just a minute typically, but a split second. But
Yeah.
So I don't know. What do you think, Commissioner Rippon?
I don't know. I don't know what to think anymore. I just know that's going to be a bone of contention
If
coming
we,
up.
if we allow Dusty to maybe look at it, getting that
Sure.
drafted, and we can take, obviously, we're not adopting something from the work session. This is just a work session so we can communicate with
Right.
staff.
Yeah.
So they kind of have a direction from us
Okay.
together as a whole.
Are you guys okay with on the outdoor spaces? I think we probably need to talk about that.
Yeah.
Yeah.
And again, my recommendation is to split the public transportation taxis and ride-sharing services into a separate bullet. I think those are important and I did observe on my way here today, a taxi cab, and both people were wearing masks inside of it. I think that's a good move on their part. So I would like to keep the public transportation one, but just separate it out.
Okay, I can do that.
Okay.
I'm good with that.
What-
And then. like
So
I said,
outdoor spaces, you're requiring a mask for sporting events, it says, bleachers, farmers markets. So if you go to the farmers market, you're to wear a mask, is that?
Yes.
Parks? If you go to a park, you have to wear a mask.
Again, we go back to our two-prong. If I'm jogging in a park and there's no one else around me, I would not need to wear a mask.
Okay.
Kind of a
If we
double.
could have that
The
language.
exertion and the
Exertion.
thing. That's
An
already
exertion
in
is a
there.
double.
That part's there.
Okay.
But if I take my son to the park and he's on the swing set and I'm standing next to another parent and we're less than 6 feet apart from each other, yes, we would need to wear a mask.
Did the governor have that in hers?
It was in section 1, I believe. Yeah, D,
Yes.
1D.
Again, it says maintain 6-foot distance with only infrequent incidental moments of closer proximity.
And I do have that to work in already. We had talked about that in that preamble.
Commissioners, I was wondering if
general rule.
we would want to add that there will be times where our rules may be superseded by other rules such as the Kansas Department of Health and Environment or the Kansas Department of Education. Again, I know that these two entities are both working on, the Department of Education is working on their school plan for the fall. And so rather than us getting into the minutia of how schools will open,
I would definitely agree with that. There's a
So-
lot of work going into that, and we
Yeah.
should hear something on the 9th
Yeah.
regarding that.
so if we just have a section, or a paragraph that says, unless unless superseded by a statewide body.
Well,
I can do
but
that.
even then,
doesn't matter.
individual districts are gonna be able to create their own plans. I don't think it's our place to
They've asked,
meddle in how they do schools.
they've
So-
asked, and I've been working with our local schools, all the superintendents, we have a standing meeting. I'm trying to develop a basic safety plan with our safety officer and some other specialists, It's basically from the CDC, and just come up with that base plan. Of course, understanding that whatever they put out from the state on the 9th, that could be adjusted. So basically, there'll be a base plan regarding COVID, and then each individual annex would be a school district separate plan. That's the direction we're going right now, unless something kicks me a different way.
Right. But again, I would just, for example, if you were to have a daycare or nursery, the Kansas Department of Health and Environment regulates those bodies.
Correct.
And so rather than us getting into how a daycare or nursery would operate, that would be superseded by a Kansas Department of Health and Environment rule. So food preparation may have, Kansas Department of Health and Environment may have some food preparation rules that are more specific.
Department of Ag may change
That'd be
licensing, I don't
Department
know.
Department of Ag.
Yeah.
So if we just had a line that said if it was superseded by a higher body.
Yeah, that's, I'll put that in a normal guide, but yeah.
Probably at some point, we're gonna have a federal law. And so, anyway. Can we talk about enforcement?
Yes.
Okay.
I noticed that ABC News reported the governor's order could carry fines up to $2,500. Is that true?
That's the statute that was put in effect by the legislature,
Okay.
and it's up to $2,500. My position is, we have two different classes we're looking at. One is the individual, and the other is the business. And at this point, I would ask the commissioners to adopt the maximum for businesses. If you have a business that is willfully violating this ordinance, that they would be fined $2,500 per occasion. And that would be a per-day violation. Because this needs to have some teeth to it. As to individuals, I would say $250.
I don't know that I feel comfortable with
I don't
that.
either.
I think honestly, the way that it's worded now, up to 2,500, that leaves it up to a judge to decide. And, if it gets to that point, I think that's probably the appropriate action, because, I guess if it's not willful and negligent or whatever on behalf of the business owner, if they just get reported because there are people in their business, I'd hate to see them all of a sudden slapped with a $2,500 fine for something that may or may not be willful.
But at the same time, I know that our department works with businesses. Dusty makes numerous trips out to explain, but we also have to give some direction to our legal staff who will be drafting the complaints.
Could we ask our legal staff?
Yeah.
Because I had discussed this yesterday with Ashley, and there were options, and my comfort level is basically to just let the judges determine the fines, if there are any.
The statute requires an intentional act. So in order to face a fine, it's going to have to be, there's not going to be the situation where it's a negligent act. It has to be intentional. So we can just put the exact language from the statute into our order that talks about enforcement, which would be a fine up to $2,500 unless, of course, you want to lower that threshold.
I would say leave it at the maximum, and then we could, if you want to leave it to the judge, that's fine. But I think, again, it has to be a willful act. So if you have a business who says, I refuse to acknowledge your order, come at me, our counselor's office would draft the complaint and then present the evidence to the judge, and then leave it to a judge as to how egregious was the violation.
That's my interpretation, yes.
I would find with that.
Well, let's see what you have to say.
So the criminal penalties, that's a state statute. There's nothing we can do about that. I mean, that's,
But we
There's-
have to add, I believe we should add a section that specifically puts everyone on notice that this isn't just a toothless order.
but this isn't our decision. It's coming from the state, correct?
But again, the resolution should have some notice provision to the public.
Okay. Now, who enforces it? Is the police, county attorney, health department? Do we have a tattletale call center? How do we enforce it?
Counselor's office, it would be, and we have the hotline already set up. I mean, I know that Dusty and his staff already deal with those things. But call it a tattletale, but again.
So if you're speeding down the street, I can call in and say, hey, he's speeding, give him a
probably-
ticket.
Probably happens more than I'd like to acknowledge.
Well, I have a problem with people just calling in. This needs to be some kind of public official rather than just somebody calling in.
If I go to a restaurant or a bar,
Yeah.
am
all
I
right.
going to feel comfortable going up to the owner and getting into a confrontation with the owner that could easily
All right,
divulge into
do your call
violence?
center, fine.
But I think that's where, if we hand it off to
We
an
got
authority, the
neighbors,
authority can come out and
neighbors
go-
turning in neighbors is what
But
we
it's not
turned into.
neighbors, it's not
Yes,
neighbors, but we
yes,
do
it
that
is.
all the time with laws.
Jim Crowell, Shawnee County Counselor. We have all spoken from the beginning since last March, and we've spoken with law enforcement, we've spoken with the district attorney's office. We have no interest in creating a police state where citizens are turning in each other for violations of rules. We've said from the beginning, we're going to work with people to try to obtain compliance. And we're going to reserve enforcement actions and the resources of this county and the resources of the taxpayers only to the most egregious situations and to situations where an individual clearly understands what the rule is, because we've talked to them usually 3 or 4 times, and they're just refusing to follow it. So this is, I do not envision a situation, otherwise you're going to need to hire me a lot more staff
Yeah.
to where we're going to be constantly fielding simple phone calls and then immediately filing a complaint against someone.
But Jim, isn't this any different than we have a dog ordinance in the county? And if Commissioner Rippon's dog is constantly running loose in the neighborhood, in the county, I would contact the county counselor's office, and you would come out and investigate and tell Commissioner Rippon to put his dog on a leash, and if he doesn't, then you would file a complaint.
That's not exactly how it would work, okay? We have animal control through the sheriff's office, and there's a process through that, and we do exercise prosecutorial discretion on items like that. Again, in that scenario, it's similar to this. We don't immediately go to filing inaction and enforcement. We try to educate, we try to make sure that the person understands what the rule is, and explain to them the effect of the violation of the rule, particularly with dogs, how it affects their neighbors. You know, it's about being a good neighbor. This is similar in a certain way, but, yeah, we will not be in the position to where we're continually fielding complaints and immediately filing enforcement actions based upon this. It would only be a demonstrated serious situation where we know that a business or a person simply refuses, and we know they understand the rule.
I would equate it to also at the city, the people call in their neighbors all the time for having their grass too tall.
Code violation.
Non-stop code violations, code violations.
Understand.
And the people that have the lawn too tall, they say, don't you have better things to do than mess with me? And the fact is that they don't levy a fine typically. They ask you to mow the lawn. And I think that's kind of where we're gonna be with this.
Good.
But education is going to be the key, and the more information that we can broadcast, the better that we educate the public, the better chance we have for not having to deal with enforcement.
What else?
I probably need to get this saved and
We
shut
got-
down.
we got 2
You got
minutes.
a 9
Minutes,
minutes.
so.
Is there anything else we need to give direction on?
Nope. think
I got enough to go on. I can get something with the counselor's office and get something back to you.
Dusty, is it possible you can get something back to us before we wrap up our meeting today? Again, I'd like to have something adopted. for us
The
today.
commission meeting?
Yes.
I have an idea,
How long
if
does
it's
it
all
take?
right with you.
Long as it-
Perhaps when we complete our agenda today, that maybe we could just, instead of adjourning, recess. We've got budget meetings this afternoon, maybe come back after our budget meetings, I think it's 2:30 is when we're done with that. And then,
2:30?
Yes.
Okay.
And that would give us a chance to review it before we
Just a
move
second.
forward.
I'm not too sure I didn't book something, man. Let me look.
we may be able to do it before the budget meetings also, because I think they start at,
I'll shoot for noon, and if you need to
Okay, our
adjust, we
last,
can do that.
our last meeting ends at 3. I've got a 4 o'clock, so you got a window there of an hour.
So
when does our first one meet?
At
I
3
don't
o'clock this
remember.
afternoon?
At the commission meeting, at the end of the agenda, just make a motion to do what you just discussed.
So announcing that at 3 o'clock this afternoon, we would return.
Well, so our first budget meeting of the afternoon starts at 2.
I'm just looking at Dusty,
Okay.
whether he would prefer 3 o'clock or 1 o'clock.
If it's after the noon time frame, tell me when you want it. I don't, there's no way I can get it done before noon, I can tell
Right.
you that. But I might be able to get something to you by noon or after lunch.
Again, I recognize Dusty and their staff have put in a lot of time this weekend working, and I appreciate all the work that they've put in.
If you gentlemen are okay with the bulk of that, then I just have to put the spirit of the order preamble and then get with the counselor's office and do that, their part. I think we can probably have it by noon, a little after. But if you want to do after 3, that makes me more comfortable. We can kind of fine tune it. Yeah.
If we can do it at 3. And then,
And what time
o'clock.
did you say you have to be gone by?
I have a 4 o'clock to,
so I don't think we're going to spend an hour on it.
okay.
I will try to
Never
get.
know.
Well, that, we can fill the time. Will that be considered a work session then as well?
That would be,
No, that'll be a continuation of the commission meeting.
and then can we take up at the same time, I know that Dr. Pizzino has some recommendations regarding bars, adopting or taking that up as well. Bars and restaurants.
So we don't have to on that, do we? Isn't,
Or-
that's something you can just do on your own, isn't it?
We delayed
There's-
action
there's
until
a-
Tuesday.
There's some communication pieces that need to happen, but we can, I think.
Again, except that you overrule